I did my teaching project on insulin administration, made a brochure for my target audience, which would be diabetics type 1 and type 2. This brochure basically just gives them information and background about their disease. Obviously, insulin is given to help control the blood sugar of those with diabetes. Just gave some information about the target audience type 1 and 2. Type 1 is usually starts in childhood, and type 2 is usually begins in adulthood, depending on their health. I gave the mechanism of action. The primary activity of insulin is the regulation of glucose. And the therapeutic use, which is used with a proper diet and exercise program to control high blood sugar in people with diabetes. Gave some common side effects to watch out for, which would be hypoglycemia, allergic reactions, and then some patient teaching. When teaching my patient about insulin administration, I would first assess what the patient already knows, maybe some learning barriers and their best way for learning. Second, depending on the patient, I would explain how important it is to keep their blood sugar under control. I would discuss the different side effects of hyper and hypoglycemia. I would third go over the different types of insulins and needles used with the brochure, and also give them the insulin injection chart. So it's just a chart that I got that shows like the different rotation sites. Let me find it. Right here. So the main parts would be your abdomen, your legs, the back of your arms, any fatty prominences. Lastly, I would go over a few days before discharge. I would ask them for a return demonstration on a finger stick, drawing up the insulin and self-administration. I would have them do it before their lunch and demonstrate the correct self-administration technique. How I would evaluate the patient is I would ask myself the questions: is the patient able to explain why insulin is important for the disease process? Does the patient have the ability to test their blood sugar? Is the patient able to drop the correct amount of insulin with the correct syringes? And is the patient able to point out injection sites and properly administer insulin?